We're here today at the Aoki Diabetes Research Institute, interviewing patients who have had metabolic activation therapy. Here I have Kathy, who's a 57-year-old registered nurse who's a type 1 diabetic. She's had diabetes for 37 years. Her diabetes is complicated by polynephropathy, retinopathy, and nephropathy. Kathy's been receiving metabolic activation for approximately 22 years, and we're going to ask her to tell us a little bit about how it has affected her diabetes and her life in general.
Well, as Mike had just stated, I was having, 22 years ago, starting to have some signs of kidney problems, signs of nerve damage, and I found out about this treatment through a friend over at UC Davis, and who works as a dietitian, and she told me Dr. Aoki's got this program. It really, helps people with diabetic complications and reverses them, or helps to reverse them. And so anyway, I did get involved with the program at that time. I was having actually my creatinine clearance, which is a sign of kidney function. It was actually low at the time that I started, and it has since normalized since I have been activated. I did have the I say paresis, but I guess it's pronounced paresis. But anyway, I did have the problems with the nerve damage to the stomach, and that has since actually improved. I had one nuclear medicine study that showed that my gastric stomach emptying time was very abnormal. It was originally back in 93, right at the beginning of the treatment, and since then it has really improved so that I am absorbing food and metabolizing food much more normally now. And so typically these types of, and I know as a nurse in my medical background, I know that a lot of times these complications can progress. They do not turn around. And yet activation, at least in my case, and I know in the case of many other people as well, it has actually been able to reverse these conditions that typically you can manage but not really aggressively reverse. So I'm very thankful that I've been able to activate all these years. And the other thing is that I'm still functional. I work as a nurse. I'm not incapacitated by having to go to dialysis and having all these other problems that I see in the hospital setting. I see diabetics type 1 diabetics, type 2 diabetics who have a lot of problems, and they are out on disability. They really cannot function. And so I'm thankful that I can still function, and I've been, as Mike said, a diabetic for 37 years. And so anyway, I'm just very thankful for the program, and it's been just a real lifesaver and a quality of lifesaver.
You mentioned gastroparesis, or gastroparesis. I say potato, you say potato.
I guess they both count.
Yes. A lot of people don't know what gastroparesis is, and perhaps you could tell us a little bit how it affects your life and how it affects your diabetes.
Well, I think that I never had it severely. I think that it was at when I originally had that nuclear medicine test, it showed that at that time it was a Dinty Moore stew that you ate, and it actually tracked, there was a radioactive isotope that was added to the stew, and then and after you ate it, then it would mark when, how long it would take to get through the stomach and all the way down into the small intestine. And normal, I think, is that you start being able, the food starts tracking, I believe, I could be wrong about this, about 20 minutes or so. And when I was taking the test, none of the food had left my stomach in an hour. I went back an hour later. Just a very trace amount was even leaving the stomach. So it was clearly abnormal. Now at that time I was not experiencing a lot of nausea, which most people with severe gastroparesis do do have major problems with nausea, but what it does is, one thing that I did notice was that I always had to take my insulin later than normal because my food was just sitting in my stomach because the nerves were not working properly. And so now I take my insulin basically at a more normal range. I mean, right when I'm eating typically is when I take my insulin. But people with severe gastroparesis, and granted this is typically a progressive disorder, so that if you, if you have it, it just gets worse with time. And I probably would have gotten to the point of having the nausea, throwing up, not being able to absorb food, and it just makes diabetes management a real nightmare because you never know when you're supposed to take your insulin, because you have to take insulin when you're absorbing the carbohydrate. So I don't know, is that explaining?
Yeah, I think very well, that I think basically what she's trying to say is that if you take the insulin and you eat and you have gastroparesis, you're very likely to have a low blood sugar reaction.
Right.
And low blood sugar reactions can be very dangerous. And so that's one of the complications that develops with gastroparesis that Kathy has been able to help avoid. I want to thank you, Kathy, for your time and,
Well, thank you.
and for the interview, and I certainly appreciate it.